Hey, it's the nursing professor here. Let's talk about 10 concepts you need to know as you prepare for your final and health assessment. So number one is the head to toe assessment itself. Remember, you're going to do an assessment from the top of the head all the way down to the bottom of the toes. And that should be in a sequence so that you don't forget any of those steps. You want to remember that over various organs, you're going to inspect, you're going to palpate, you're going to percuss, and then you will auscultate, except when it comes to assessing for bowel sounds, because you don't want to do that, but we'll talk about that in a few moments. You want to compare normal versus abnormal findings, and then you're able to look at all of it at the end. Number two is vital signs. You should know normal vital signs. Know the most accurate way of gathering that data. For example, the most accurate way of getting a temperature is a rectal thermometer versus an oral thermometer that may be influenced by hot or cold. Then you go to the cardiovascular assessment. I want you to go back and check out my video on heart failure, because that's going to give you a lot of information about cardiovascular assessment. But also note that heart sounds are typically S1 and S2. You will listen with the diaphragm of your stethoscope, and if it's a murmur, you want to turn to the bell of the stethoscope, because those are much high pitch sounds. You want to look for things like edema, especially in the hands and the feet. If a person has that, you want to compare side to side, and you want to elevate those extremities to help decrease the edema. You also want to look at the side of the neck for jugular vein distension, because those could be signs of circulatory problems. All right, and also the video on EKG. There's a very short video on EKG, what it actually means. Go back and check that one out. Respiratory assessment is next, and this is where we're going to listen to the lung fields to determine if there's any abnormalities there. So we're going to assess for people who may have disease processes such as asthma, pneumonia, bronchitis, emphysema, COPD. Those would be examples of patients who may have some abnormality in their respiratory assessment. You want to know what a normal respiratory rate is. For an adult, it's usually 12 to 20. You want to be able to look at the rate, the depth of when a person takes a breath, and the ease of breathing. You know, are they using accessory muscles, or does it seem like they're putting in a lot of effort in order to breathe? If a person has on oxygen, you have to note that it's flammable, so you want to make sure that you teach people not to smoke around it or light candles or any of those types of things like that for safety. You should know the various types of oxygen delivery system, from the nasal cannula all the way up to the ventilator. So your nasal cannula typically goes from 1 to 6 liters. The higher the number of liters, you want to make sure you include humidification, because it can be very drying to the nose. Next would be your face mask that can go from 6 to 10 liters. Again, can be very drying, can be very uncomfortable. You need to make sure that your patient will keep that on. And then it is the Venturi face mask. And this is actually one of the most accurate ways of externally delivering oxygen, because it allows you to fine-tune the amount of oxygen that a person is getting, and it can range with a delivery of anywhere from 4 to 10 liters. Next would be your non-rebreather, and that's usually about 100%, and you can only imagine how difficult that is, which is about 10 to 15 liters of concentrated oxygen. Now, we want to do frequent pulse oximetry when we're actually assessing a person who has on oxygen, because we want to be able to dial that down. There is a such thing as oxygen toxicity, so you don't want to keep anyone at a high level for too long. All right, next is a neuro assessment. I just did a video on neuro assessment. I'm going to send you right back there because that is more detailed, and where it looks at Glasgow coma and the NIH stroke scale, which is basically everything that you need to know about the neuro assessment along with cranial nerves. And there's a video out there on cranial nerves as well. Then we go to the abdominal assessment, and then that's when you're going to listen to the 4 quadrants of the belly. You're going to make sure that you're going to inspect, and then you're going to auscultate. Put those ears on and listen to the bowel sounds, and you should listen for a full minute in order to determine if the bowel sounds are absent or present, or they're hyperactive, or any of those types of things. You do that because you don't want to palpate or percuss before that, because you could artificially get bowel sounds that would not normally be there. All right, so you're going to, look for any tenderness, ask your patient about last bowel movement, what they've eaten, if they have nausea, vomiting, all of those types of things. All right, and as you palpate, you're feeling to see if you can feel actually any organs that may be enlarged in the abdominal cavity. Musculoskeletal assessment. Here I go again, referring you to another video, but there is a video out there from, I think, last week, where I actually look at the various exercises that you should do and understand that your patient may have to do. You want to look at range of motion. If a person can do their own range of motion, you allow them to do it. If not, you can assist with that. The importance is we don't want muscles to atrophy. That means that if they're not used, that they will get smaller and smaller, and then they'll no longer work. We don't want a person to get contracted where they'll end up staying like this and won't be able to extend over a period of time. We don't want that. And so by that, we're going to continue to assist the person in using their musculoskeletal system, even when they may be in a coma. You also want to be aware of assistive devices if a person needs that. For example, if a person needs a cane, what side of the body the cane should be on the strong side. If a person uses crutches, how they should use them. Advance the crutches first and then step through. Same would be true with a walker. So you want to go back and review that information. For skin, hair, and nails assessment, you want to make sure you are assessing for color, temperature, skin turgor, any lesions, abnormal looking lesions that may be on the skin. Along with assessing skin, you want to make sure that you're paying attention to any open areas that the person has, and know about the stages of wounds, 1 through 4. Remember, wounds do not go back. Even if they're healed, they're always called a stage 4 wound or healed stage 3 wound. When you're measuring wounds, you want to go up and down, side to side, not anything else, because that uniformity will make those measurements more accurate. And if you have eschar, which is that black tissue, it is unstageable. It is impossible to see through eschar, so you are not going to say that that is a stage 4 wound. Mental status and psychosocial assessment. You're going to ask a person questions to determine if they are alert and oriented ×3 or ×4. You're going to ask them, you may do a mini mental, which takes about 5, 6, 7 minutes. If you assume or if you know that this person may have a history of some forgetfulness, you can get some information with that. Assess their mood, make sure that they are engaged, not depressed, not talking and letting people talk for them, and all those types of things. Last but not least is documenting. If it's not documenting, it's not done. You must document accurately, clearly, as soon as possible, so that you won't forget any of the information. Now, along with your documentation, there's one other thing I'm going to mention here. It's SBAR, S-B-A-R-S. You give the situation, and if you were given a situation, you might say patient fell. All right, you're going to give the background. This is a 49-year-old that was admitted for pneumonia. They had some weakness. When you came in the room, you found them on the floor. Okay, you're going to give some medical history on them. And then your assessment is going to tell more about the patient, including the vital signs, if they're complaining of pain, if there's a bruise, if there's an open area, any of those types of things. And last, any recommendations that you might have, because you're there. And when you're calling the provider, they're not there. So you want this communication to be as accurate as possible. So I hope that helps. Good luck on your exams. Like, share, thumbs up, and I'll see you next video. Bye for now.